Breakthrough moment today when we learn the first doses of a coronavirus vaccine could be available in just 2 weeks.
And a CDC panel has a plan for who should be the first to get them. CBS 2's Jessica Layton live tonight in Newark, a city fighting hard to stop the spread. Jessica.
Maurice and Christine, you know the vaccine is so needed in a place like Newark where the infection rate today is still over 16%. Still, getting everybody to trust the vaccine will be a hard sell, especially when you consider about half the workers here at University Hospital are skeptical. It's a plan that could finally bring the pandemic to a halt. The CDC advisory panel is prioritizing 24 million healthcare workers, along with nursing home patients and staff, in the long line of those waiting for a vaccine. Distribution could begin in 2 weeks. Then in January, an estimated 87 million essential workers would get vaccinated. That includes teachers, police, firefighters, food production, and transportation workers. Next, adults 65 and over, and those with high-risk medical conditions. That's more than 153 million people. But even at warp speed, it could still take 5 months to get the vaccine to everyone who wants it. Health experts say it's not only a race against the clock, it's a battle to reassure patients this is safe.
There are people who are skeptical, lots of people.
In fact, a recent survey shows only a 40 to 60% willingness to take the vaccine.
And that percentage is even lower for people of color, in particular Black Americans. And that's also very concerning because these populations, particularly people of color, are disproportionately impacted by the disease.
Dr. Sharif El-Nahal heads University Hospital in Newark. The husband and father is participating in a Moderna clinical trial. Understanding the root of the mistrust in communities of color, he says education and outreach will be key.
Really try to convince people to take the vaccine using data, using arguments that are based in science, and also recognizing the history of medical experimentation in the Black community that wasn't always conducted ethically. In fact, it was a representation of systemic racism.
For the people who don't trust this because they feel like the process was rushed, is that valid?
He says trials are now done much more quickly when there's more participants.
In these trials, 10 times the number of people were included than the number of people normally included in vaccine trials.
So let's assume the FDA does say okay to the Pfizer vaccine at its big meeting coming up on December 10th. We're told hospitals could start getting their first doses of that vaccine just 5 days later. Reporting live in Newark tonight, Jessica Layton, CBS 2 News.